The South African Council of Churches were among organizations that pushed very hard for the national lockdown in order to contain the spread of COVID-19. Joining me now to discuss the role of the church in this trying time is the SACC's General Secretary, Bishop Malusi Mpumlwana. Bishop, good morning. Thank you so very much for joining me. Now, there has been a lot of anxiety in our country. There's also been a lot of fear and uncertainty. We know tomorrow the most vulnerable in our society go and collect their SACC grants. What is the message from the South African Council of Churches to the South African people during this time?
Karima, most certainly this is a very sad time. It's almost like the country has to accept a painful injection in order to avoid an amputation later.
Yeah.
If we don't do this now, we will have an amputation later. And so it's very painful. Let's make no mistake about it. It's got huge economic implications on lives of people. It raises anxieties. There are businesses that are required by law to open any number of hours in order to retain, their business hours, which they cannot do under the circumstances. There are jobs that are going to be lost. Imagine what's happening to street vendors, people that actually live from hand to mouth, that cannot get any business for 3 weeks. What about beggars and people that depend on that handout each day? And so this is going to be the tourist, transport and hospitality industries are the most hit. But it's painful as it is. We have to do this. And so we have to persuade South Africans that the best way to deal with it is to comply to the T within the 21 days, because that then allows for a stymie, a halt, a prevention of the spread. It is unfortunate that a lot of people thought, wait, if I must go home, it means I must go to my home village. And none of them knows whether they are carriers as they go and whether they're going to arrive there and actually spread the virus. And so we may find that in the next 21 days, we will surface a whole lot more than we anticipated. But even this might mean that actually the 21 days has to be extended. And this is why there is a need for a lot of considerations. First of all, this is going to exacerbate tensions in homes. You're going to find a lot more heightened domestic violence. And I'm told that in France, domestic violence has gone up by 36%. Now, that's for us, this is already a plague in this country.
Yes.
You can imagine this is going to lead to. So there's going to be a need for a lot of access opportunities for women, especially, to be able to call out somewhere for assistance. And there will be unfortunate extremities that are going to come as a result of this. But also we know that there is a need for a lot of support, maybe food handouts, if not, at least some vouchers. And I think the SACC is looking at creating food vouchers that can be accessed. People can get those vouchers online, and then they can go and get supplies at the supermarkets. But the key thing is that
Bishop, let me just come in here. Bishop, let me just come in here. You've raised a very important question about the most vulnerable in our society. We've seen, for example, temporary homeless shelters being put up across the country. Is the church coming to the party on this? We've seen, for example, buildings, government making buildings available. Are you considering a move like that? Are you working with your local councillors in communities? Because there are, for example, church structures in almost all of our communities.
We are creating a nationwide network of communication that is going to be launched in the next 2 days, where we're inviting every congregation of every church to have a WhatsApp group within that congregation. And then we're creating a platform, a national platform with a joint operations center that then reaches out to every person in every congregation in the country, so that they then are able to draw in and identify the pressures and the agencies and the needs in that area. Then we can be able to coordinate this. Otherwise, it's going to be haphazard. There's a church here in Mamelodi, for example, where the homeless went to the police station, and the police station said, go to church so-and-so. And we are totally unprepared. The pastor calls me and says, got this message. People have just arrived. They said they were told to come to my church. I'll have them, all right, but I've got no capacity to take care of them without preparation for it. So you do need to have a properly organized system of doing this, but it's urgent. It's got to be done almost like today, yesterday, the day before.
Now, Bishop, one of the big things is, of course, funerals. I've had two friends who have lost family members, and they were very concerned about whether they can travel. We know the reality of South Africans. People often don't live with their families, and traveling to provinces, if you're not immediate family, is, of course, not allowed. What is the church doing to help contain that number of 50, given also our cultural traditions in South Africa where people don't wait for invitations to go to funerals, they just go?
Because you don't want to get anybody standing at the door and say, number 49, 50, oh, please, stand back now. It's going to be impossible. In rural villages, Karima, there's one funeral a day. If the two people are due to be buried on the same Saturday or something like that, they actually have to be requested to postpone. The one who died last must be postponed to bury the next day or the next week. And if it, for any reasons, it's necessary to do it on the same day, in some villages, you actually have to go to the chief or the nduna to get permission to bury on the same day, having had a conversation with the other family. So that's how difficult it gets to be. I would have said, if it were up to me, and I know this is even worse in terms of emotions, I would have said, can we postpone all funerals? Anyone that dies now, put it off until 3 weeks' time. But then you raise the problem: how are people going to pay for this at the mortuaries? Is there a way in which the funeral insurances can absorb some of this, and the state can support, so that you minimize, because there's no way you're going to keep people from each other, and that will then mean that we stretch this thing even longer. I fear that we're after these 21 days, we will come into a South Africa that has had many more infections, and a situation that is hard to contain.
Absolutely. Now, given that reality, we've seen the numbers rising. We are well over 1,000 already. We're working our way toward the 2,000s. I'm convinced that the numbers will continue to spike. Are you satisfied, Bishop, that the testing that the government is doing and the results, that it is fast enough? And should we not use this social distancing period and this lockdown to massify testing? I haven't seen any announcements of mass testings yet.
I do not know what the capacity is, but I also know that the lockdown is going to allow those that are already infected to surface, but they'll be surfacing in their homes. They are not going to be surfacing and they go into the train, into the bus, and then the taxi. They'll be surfacing in their homes, so you can sort of contain it within that family and deal with it there. I think the state will be in a better position to live with that kind of minimized, localized situation. But it gets more difficult if, particularly in places that are very densely populated, like our informal settlements. How on earth are people going to be locked in a 6 by 6 foot shack? This is a disaster.
Now, there's been a discussion around possible policy changes. I've just discussed with the Social Development Minister whether we should be thinking about a universal grant, considering the economic impact and that jobs are going to be lost on a massive scale. There's also the question of the national health insurance and making private healthcare accessible to all South Africans. What is the message from the church to private healthcare during this time? Because health clearly is a public issue.
We've been advised that I think everybody has been hearing the Minister of Health saying that there is great collaboration between the private and public sector in these areas, but that does not. I think it is contained to testing and dealing with the COVID situation. You can almost say, let's waste a good crisis. This is a bad crisis, but it can be good in terms of accelerating the integration of the health systems in our country, and I think what was intended for later should actually be brought forward. With the COVID situation, a lot of people are going to be. There are other cases of health that will need to be attended at a time of greater economic depression in families, unable to all flood in the public health system. So it indeed is necessary at this time to say, let's just give it a trial. Let's do it for now and say for the next 6 months even, we will have free access for everybody in the same way that we do with public institutions, and see what happens in that regard, and sort of have the subsidies that we thought were possible through the NHI can come now. And if the government says they can draw money from the IMF for health services, that's where that money should go to.
All right, Bishop, we've run out of time. My apologies. Thank you so very much. That is, of course, Bishop Mpumlwana speaking there about the need for the private healthcare system to assist government in this pandemic. Well, you've had your fix for this week. Join me again next Sunday. Thank you for watching.